Hi, I'm Matt Buffton. I'm here in Windsor, Ontario, just across the river from Detroit, Michigan. Now here in Canada, we have a universal, publicly funded healthcare system. The government both provides the money and manages the system. In the United States, there's a different system, and there is no universal public healthcare. Critics here in Canada say that if we were to allow private sector healthcare delivery, we'd end up just like they are. But the question is, are these the only two models? Is it possible for a public universal healthcare system to exist side by side with private healthcare delivery? I'm going to go across the street to the University of Windsor and find out what some students think about this issue. So tell me what you think about Canadian healthcare.
Well, I like the fact that we've got socialized medicine.
I think it has its problems, but I think overall it does its purpose.
Overall, I'm pretty happy with it, especially having American friends who have to pay so much money.
I think the actual organization of it is not that great.
I think we can do a better job of providing healthcare to our citizens.
What do you think about the idea of having competition in healthcare with a private sector?
With the private sector? I don't think it's a good idea.
I think that competition between the public and private system might be problematic.
I do think it would be a slippery slope, and I think it would be a bit scary. I'd rather have just better basic healthcare for everyone.
I think it needs to be something that can be closely monitored.
The fact is that Canada's ban on the provision of medically necessary services by the private sector is rare in the developed world. Equally as rare is the absence of universal public health care in the US. But are people aware that the socially progressive nations of Europe allow a private sector healthcare system to compete with their public universal system? Would you be surprised to learn that countries like Sweden and France and actually most of Europe has a private sector as well as a public sector in healthcare?
A little bit, yeah.
I'd be very curious to know how it's working out for them.
I would be surprised to hear that, yeah, because it's not advertised that way.
Many Canadians are genuinely surprised to learn that so many other nations allow a private sector to deliver healthcare in competition with a universal public system. But it's a basic principle of economics that competition forces suppliers to deliver their goods and services more effectively to their customer base. Other nations use this principle to ensure their citizens have access to the best healthcare in the world. Here in Canada, maybe it's time we realize there's more than just two models of healthcare. We like to think we live in the best country in the world. Maybe it's time we had a healthcare system to match.